The American Cancer Society, the American Diabetes Association, and the American Heart Association have come together in a historic collaboration to focus on chronic disease prevention.
And when we got together and realized that we're talking about 1.5 million deaths per year if we aggregate the premature deaths from all three diseases, we said we need to work together.
I think the recognition that several organizations which have, quite frankly, in some elements had to compete for volunteer time, compete for donor dollars, have said we're going to rise above that. We're going to put our efforts together, and we're going to put our efforts together because the problem is so important.
Our three organizations feel a sense of urgency today because we understand that there are 10,000 ways you can check out of this world, but 90% of all deaths in America last year were from 10 things, and 90% of the 90% were from 4 things: cancer, heart disease, stroke, and diabetes. And all 4 of those diseases we can reduce dramatically, perhaps by as much as 2/3 a person's risk of dying prematurely from those diseases. It's time we work together.
So these risk factors and the diseases that they're associated with are interrelated, and so it makes much more sense for all 3 organizations to work together to highlight the importance of these risk factors.
Now, changing behavior is a very difficult thing, and so I'm not sure that we could do it by ourselves. But I think that if we actually put our best foot forward with these other 2 organizations, we may be able to change the way America views its day-to-day life.
I think particularly of the children, because an awful lot of what we have to do here is to influence both the current adult, but also the next generation of adults, because everything we know about lifestyle and about obesity and body weight is something that begins, for the most part, early in life. It occurs in the first and second decades of life.
The public feels as though it gets a lot of messages about all of these diseases, about things they should do for their health. There's tremendous confusion. But in fact, we're giving the same messages. Eat right. Be active, don't smoke, see your doctor. We all agree about those, and the fact that we can give those messages together, that we can say that to people in a simple, powerful way, I think will have a tremendous impact.
The truth is that the diseases that we're working on are far more preventable than they are curable.
A change of lifestyle eventually will help you. And please take it seriously, because these diseases are serious.
It's time to put that passion into action.
So this new collaboration with the American Heart Association and the American Cancer Society, joining with the American Diabetes Association, is something we view as enormously exciting. It provides us with an opportunity to reach jointly with these other 2 wonderful organizations, audiences that we have not reached before.
The disease conditions on which each organization is focused share a lot in common, and I think we can approach these disease conditions most efficiently by pooling resources to bring the public's attention to the impact of the major risk factors on these diseases.
The more people who speak the truth to people in this country, the better we're going to have an opportunity of changing the way they look at their lifestyles.
We know that chronic diseases that impact all 3 of these is much larger than any one organization could ever impact on its own.
It's a little bit frightening, but it's also exciting that we may be able to really make a difference in this country by the year 2015 in the way of decreasing incidence and mortality from cancer, but moreover, decreasing deaths from heart disease, from stroke, and from diabetes.
It provides us opportunities to share expertise within our staff, within our volunteers, that will magnify the work of each of those organizations, in addition to providing new opportunities as time goes on for areas of collaboration that I think, frankly, we haven't even thought about yet.
This is an exciting time within our organizations because each of us have an advocacy component where we assist to change the environment in which people live. And so this is a time when we can collectively come together, all three organizations, and advocate with one voice on a consistent message.
I think this is but a beginning. We certainly look forward to working with the American Cancer Society and the American Diabetes Association to focus on the major areas of health that are common to us.
We now have something that unites us. We know that we can really affect people and their diseases, and we can prevent some diseases. And I think by coming together, delivering a common message, will reach the people that we need to reach and really affect and change their lives.
If we do the right things, we make a life-saving difference.
As a group, we can work together to help the public to live healthier, longer lives.
If you think about it, these four diseases, cancer, heart disease, stroke, and diabetes, are, in the aggregate, the most preventable and the most curable of all of the chronic diseases facing Americans today. If this campaign works, and I hope it will, we'll transform that potentiality into reality for all Americans.
This historic collaboration will bring new resources to volunteers, staff, and the millions of Americans who look to these partner organizations for health information. This year, we introduced the everydaychoices.org website, a consumer brochure, joint scientific papers, a public policy event on Capitol Hill, and our toll-free consumer hotline. And, sponsored by the Ad Council, we present a compelling new print, radio, and television ad campaign that will reach audiences across the nation.
This is fine. Thanks.